here on New Era TT Radio, Net Radio.
Welcome to Drive Time Exchange. As rubber hits the road, hard talk meets great music. Monday to Thursday, 4 to 6 p.m. on Net Radio, taking you above and beyond.
Trinidad is my land, and of which I am proud and glad. But I can't understand why some people just talk it bad. But I know all of them be running them home. Don't know what they're talking about. They will paint their black every day, and the right things they will never say. Life of fast is human, been rated among the best. Our scholars have sit and passed every test, and put us right alongside the rest. But then our pitchley is the greatest one of its kind. Our sugar and oil is really refined. So you see, friends, this is a real King Solomon's mind. They just talk some nonsense. Me and know what they're doing it for. About so much violence, man, you will swear that they're fighting war. Of course, we have the delinquents to face, but just like any other place, look, the things they will say about here. It's really too much for me to bear, because my people are daily making progress without any form of stupidness, and in this way we must gain success. For when we move in, we all move as one body, no bigger in between you and me, for our politics and for racial equality. So when a stranger spending a little time in this lovely island.
All right, everybody, good afternoon to you. And of course, welcome to the Drive Time Exchange. And of course, it's happening right here on New Era TT Radio. We are the heartbeat of the Caribbean. We take you above and beyond. As we jump inside our Drive Time Exchange, of course, on a Monday and a Tuesday. Well, we got away yesterday because of the holiday and everything. So I'm still in a little independence mood for Tony. But good afternoon to you. How are you doing?
I am good. I can see that your Independence Day was well spent.
Well spent right here.
Yeah, it's been a different kind of Independence Day. For those persons who love the parades and all of that military stuff, they were disappointed. But clearly there was Steve on the road and other kinds of celebrations, including the day of prayer celebrations, which was held, they were held at the Diwali Nagar in the Chaguanos area. So there was a lot of stuff to be done in that period of time. Okay.
As they say, we did it how best we could have.
That's right. So what we are exploring today is a subject matter, a disease. I don't know if that's the right term. The persons, our guests will tell us what's the technical term for it. But surely it's a condition which, again, too, I am saying that it's prevalent in the country because I hear about it all the time. But I don't know exactly. I can't give you figures as to population head and people who contract the disease. Contract is probably the wrong word. But again, the experts will tell us all about that language. It's the business of prostate cancer, which is something that I understand affects males only, so women get away from that. But I suppose they have things which we males get away from, so there is some kind of evening off of the balance outside here. So we're going to talk about prostate cancer because, as indicated, it's in the country, it affects a lot of people, and therefore we thought we would give some information and guidance to it. And that came about because I heard my good friend, Sunil Ramdeen, who was a young reporter way back when at ABM Television when I first met him. He was attempting to become the first test batsman to come from Princess Town, but that didn't work out as well as he wanted it to work out. And Sunil had the disease and he overcame. I don't know if that's long-term, short-term, whatever. He will tell us all about it. And my very good friend, Dr. Lester Goetz, who is the senior urologist in the region, really, University of the West Indies lecturer, somebody who has trained generations of urologists, was the director of the San Fernando General Hospital, medical director at some point in time. So what I want to do is and I know Dr. Goetz has a limited time with us, but I want to start with Sunil by giving our listeners and our viewers some indication of this disease, how it impacts, and how you have to deal with it medically and in your own personal capacity. Welcome to the program, Sunil, and give us an appreciation of how you contracted, if you knew how you contracted it, how it is contracted, all of the details of that.
Hi, Tony. How are you? Great seeing you. Let me say good afternoon to Dr. Goetz, of course, Sir Charles, and everyone who's listening. And I really appreciate you having me on. Yes, all the way back to Win TV days. But
AVM television, not
AVM television.
Come
that's
on,
right.
get your television stations correct.
AVM television. That's right.
Right.
We've done a few, haven't we?
Yeah.
And this is your prostate cancer. For me, it's a very personal journey, and what I've come to appreciate and realize is that there are many men out there my age who may very well be sitting on a very serious, life-threatening situation, and they don't know about it. And early on you said it's something that impacts men. It impacts men and women indirectly, which is why I think it's a conversation that our women need to be having as well, especially with their men, and especially around in the context of some of the taboos that surround prostate cancer. Because if you lose your loved one, then it's going to impact the entire family. And it was quite a surprise to me. And one of the things that I've come to appreciate is there's a lot of misconception, and I know Dr. Goetz is going to certainly elaborate on it, but there's a lack of information, and there's a frightening and alarming lack of interest by men, particularly men who are in the age group, which I've learned is not as old as we would have thought, who might be carrying around this disease. And it's something that and again, Dr. Goetz will go into the actual medical aspect of it, but I was just 49 years old when I was diagnosed with prostate cancer, and it happened by accident. When I say accident, it was nothing that I had on my mind. I never thought about prostate cancer. I never discussed prostate cancer. As far as I knew, there was no history of prostate cancer in my family. And I went to an internist, and he was just running general checks, and he ran a PSA test. He just threw it in. And when I had my follow-up with him, he pointed this out to me, and he said, look at your PSA. My PSA was 22. And the funny thing is, I didn't even know what that meant. That had no impact on me because I'm not thinking about it. And I'm sure there are a lot of people out there who are not thinking about it. So I look at 22 and I go like, I guess that's bad. That was really bad when I started to do my research into it. And he flagged it and he said, but this is a possible indicator for prostate cancer. And he had me go to a urologist. We went through some tests to see whether it was an infection, which it wasn't. And then I did a follow-up PSA, which came in at 18, again, incredibly high. Then I did my physical test and a biopsy. My initial Gleason score came in at around 8. And eventually, after surgery, my final pathology was 9 out of 10. So at 49 years old, not having a clue and not even thinking about it, I was diagnosed with an extremely aggressive form of prostate cancer. And if I had not done that testing, if I had not done that screening, if I had not followed up on the conversation, if I had not gone to the urologist and gone through the tests, then, heaven knows it's 4 years later, and heaven knows where it would have been because it had already started to metastasize into the lymph nodes.
Okay. So that's your personal story. Let me go to Dr. Goetz, Dr. Lester Goetz, as I indicated, urologist, and someone who has been attending to patients, diagnosing the disease, and indeed training urologists to be in the field to deal with this thing. Dr. Goetz, can you give us a technical but not too technical understanding of what is prostate cancer? What it is and what are the effects of it?
Okay, I don't know where you want me to start, but I mean, it's literally a cancer in the prostate. I suppose people want to know where the prostate is, and that is important as well because the prostate is stuck onto the bladder, your urinary bladder. That's why a lot of people come with urinary symptoms, complaining of difficulty passing urine, blood in the urine, going often, getting up at night, frequency, urgency. That sort of urinary problem seems to be the most common way of coming to the doctor when you have a complaint. The prostate itself cannot be seen. Just like you could see your hands and your eyes and your ears, but you can't see the prostate. We could only feel it by going through the rear passage, the rectum, and if it feels like the tip of your nose, nice and soft and smooth, then you may not worry so much. But if it is hard or irregular or there's a nodule, that is suspicious. But even if a prostate feels like a normal prostate, you could still have a cancer deep inside that we can't feel. So that's why we depend so heavily on the blood test, because sometimes you can't feel it, but it's there. And what your colleague has just stated about the blood test, that his PSA being high at age 49. In your 40s, you see your PSA blood test is a marker. We call it a tumor marker, in the sense that if it is for somebody in the age 40s, it should be reading 1, and his own was 22. If you're in your 50s, we expect it to read around 2, in your 60s around 3, and then people 70 and over 4. So these are the numbers, single figures. And so if somebody comes in their 40s and their PSA is 3, and you say, oh, it's less than 4, but it shouldn't be for that age group. So 3 would be high for a 40-year-old person. I mean, 22 is really, really high. And how we categorize the cancers is into risk. We say low risk, intermediate, and high risk. So for a blood test that is less than 10, the PSA blood test, we say that's low risk. Low risk that the cancer has spread outside of the prostate. If it is between 10 and 20, you call it intermediate risk. And above 20, that is high risk. High risk that it has already gone outside of the prostate, whether to the bones or to the lymph nodes. And as in your case, it was 22, so it already started going to the lymph nodes. So that was high risk cancer that you had. Yeah.
Can you tell us, Dr. Goetz, what is the prostate and what's its purpose in the body?
Okay, so the purpose of the prostate is a gland. It has glands and it has smooth muscles, and the urine passageway passes like a tunnel through the middle of the prostate. So that's when the prostate gets enlarged. It doesn't have to be a cancer. If it gets big, it could squeeze that passageway in the middle and block the passage of urine. So some people they can't pass urine, and they have to be catheterized. And the whole purpose of the prostate is...
Sorry, what do you mean by catheterize?
Where you put a tube into the bladder to let out the urine that has been blocked by the prostate. That could happen if there's no cancer, just an enlarged prostate, but it could happen as well with a cancer, which is a harder prostate, and that could actually squeeze. The hardness itself could squeeze the passageway. But the thing about it is the prostate job is to make babies. So that is its only purpose. So the prostate produces the ejaculate. So when a man ejaculates and there's a liquid that comes out, that is made by the prostate. The sperms are not made by the prostate. Sperms are made by your testicles or your balls. So the two have to connect, and the sperms cannot swim, they can't move, they can't do anything without this liquid that is the prostate produce, which is your ejaculate. So the two work hand in hand. So if you don't have a prostate, it means you can't have children. Basically, it is to make children.
Okay. What are some of the circumstances which bring on the prostate to be a problem instead of functioning in the ways that you've described?
Well, age. Age is the main thing, because we very rarely, I shouldn't say we never, you could never say anything like never, but it's very rare for somebody to have prostate cancer under the age of 40. So you wouldn't have children with prostate cancer. It's age related. So, and this is why we tell patients to check their prostate from age 40. In Trinidad and in the Caribbean especially, that's our guideline. From the age of 40, one should be doing his PSA blood test annually and check. So you know your age, so you know what your PSA is supposed to be. So in your 40s, it should be 1. Your PSA blood test should be 2 in your 50s, not higher than that. So anything higher than that, alarm bells will ring. I mean, it could be an infection in the prostate, but really we infections are easy enough to treat. But we want to know if it's a cancer, because a cancer can lead to your death, you know. And therefore, so the prostate's role is really to produce your ejaculate, so that the sperms coming from your testicles or your balls can now swim and move.
Okay. What brings it on? What brings this disease on to the prostate?
Well, there's a strong genetic influence. There's a professor in Johns Hopkins by the name of Pat Walsh. Some years ago, Pat Walsh would send us requests for samples of the patient's blood and so on to see if there were any genetic traits. And he thought that in those days it was only 10% was genetic. But today, with better technology and that you could pick up cancer genes, it's up to 55% genetic. So there's a strong genetic. And long ago, when we treated prostate cancer, we treated you, the patient. We never spoke about relatives. Now it's mandatory. We tell you, anybody, any man in the family, your cousin, your nephew, your children, your brothers, your uncle, whoever it is, tell all the men to come and check their PSA, because they are at a higher risk once there's a genetic predisposition. So it is so powerful, the genes, that we can't ignore the relatives anymore. Right? You know, before we just treat the patient, amen. And now we have to actually tell them, go and talk to your family, because, you know, they are at higher risk and they will pick it up at an earlier age as well. So
it's genetic, as you are saying, but are there circumstances of individuals, your diet, exercise, etc., and so on, that brings it on?
Ethnicity as well, because in Trinidad, we found that up to 75% of the prostate cancer we see tend to occur in Africans, and not as common in East Indians or Chinese or other. That doesn't mean it can't occur. It's just that we know there's a tendency.
Sunil is an example that it occurred outside of that group, right?
Exactly. And sometimes we see some very advanced cancers in the non-Africans. So there's nobody is safe, and everybody should be checking their PSA blood test from the age of 40. We call that screening. Screening meaning you have no complaint whatsoever. You're playing football, you're captain of the cricket team, you're fit, you're strong, you're healthy. Still check your PSA, because a cancer could be inside the prostate and you don't have a clue what is going on until maybe it gets too late.
Right. You know? So Sunil, you talked about this this condition that you were shocked when you were diagnosed with it. After diagnosis, what were the symptoms? I suppose is the correct word. Did you feel pain? Were there things that you could and could not do? Give our listeners, and remember all the time, gentlemen, that we are doing this program to inform our listeners and our viewers outside there, how you have to check for this thing, how frequently that you have to do it, and what are some of the symptoms that indicate that at least you had to check for something. Sunil.
Yeah, so that's a really good question, and I mean, and that's why, as you said, Tony, information is so very important. The truth is, I was unaware of any symptoms that I might have had until after I was diagnosed, and then started doing research into it, and then started getting information. But the truth is, even in light of the symptoms that I found that you can look out for, the only two that I could possibly think that I had was, a bit more frequent urination and in the getting up in the night, and maybe a little bit of pressure sometimes. But that was it. I mean, beyond that, I wouldn't say that I really experienced many of the symptoms that were outlined, but there are quite a few symptoms.
Or what made you do the PSA blood test in the first place?
So I didn't do it. I mean, I really went for a general test with my internist, looking for cholesterol, looking for diabetes, and he just happened to do the PSA test. I mean, look, honestly,
that's what you would call
screening. I may not have done the PSA test till a couple of years later.
Yeah, screening means no serious complaints, and you just went for a checkup. That is what screening means, and that is what. If this program has to tell you anything, this is what this program should be telling men in Trinidad. Don't wait till you have a complaint to go by the doctor. From age 40, just go and check. Just like women go and check with a pap smear to see if they have cervical cancer. They don't have a complaint, but they go by the doctor and he says, okay, let's check, because that is a common cancer in Trinidad. Let's check for prostate. Prostate is still the most common cancer in Trinidad. It accounts for 20% of all the cancers, closely followed by breast cancer, which is the second most common breast cancer in women. So prostate is the leading cancer according to our National Cancer Registry. And number 3, it's colon. So colon is running right behind prostate. Colon is running right behind breast cancer. So my brother-in-law in New York, on his 50th birthday, he got a birthday card. Congratulations, you made it to 50. So you say, who sent me this card? Exactly on his birthday. And when he opened the card, it was, well, you are now due your first colonoscopy. Please call the health center at this number. It's amazing how the technology has, and that's what we need to do in Trinidad. Congratulations, you are 40. You are now due your first prostate, your PSA. Congratulations, you are 50. You are now due your first colon test, like that. And that is the stage we should be reaching. We haven't reached it as yet. Still too many people come. I have patients come to me with PSA of 3,000. And the cancer has already spread all over their bones, like President Biden. Some of them come in paralyzed. I mean, so late, so advanced. So there's some information that is lacking to our population, and that is one of the projects I think the Ministry of Health could work on. And one of the things they can do is just like what Tony is doing. Somebody famous like yourself should be on television, on radio, and that is what they do abroad. They get famous personalities and let them talk about their personal experience, and that could wake up people. Go check your prostate from 40, go check your colon from 50. And that should be a routine. That shouldn't be like, I'm waiting till something happens. Yeah. Don't wait.
Dr. Goetz, let me get you on a subject that men, well, it's a male disease, men are reluctant to because of the old finger test. Man does not want another man or even a woman sticking his finger up in his rear I don't know what's the technical word for it. And
Yes.
therefore they are afraid to go
DRE.
and do it.
Digital rectal exam. Yeah, DRE.
All right,
But
good.
there is a fear there. Actually, it has reached the point now where people, it's not just in Trinidad, all over the world, and where they have started doing what you call PSA screening. So no rectal exam, they just do the blood test. So it's dependent on the blood test, because blood test is very, very sensitive and will even pick up the cancer sometimes before the rectal exam. Although we've had patients, let me tell you, and I've had a couple of patients from Tobago who had normal PSA blood tests, and when you did the rectal, is this huge cancer in the prostate. So there's a stage where it's an advanced cancer. It destroys the cancer itself. Is so aggressive that it destroys the PSA production, and therefore you don't produce the PSA. So that could also happen, but that is rare. So we still recommend the digital rectal exam. Nobody has ever become homosexual because of it. It takes about 5 seconds, and right away you could pick it up. But the better thing to do it is do it with a professional who is doing that. I mean, I am doing 10 digital rectals a day, every day, people talking on the phone while I'm doing it and stuff. So there's a technique so that you don't feel any pain or discomfort. So I think you probably, the people who are interested in having it done, let them go by a professional person who does a lot of digital for years and years, and therefore it becomes painless, I think the fear is unfounded. It's nothing. Your finger is much smaller than when you have a bowel action, and your number 2 is much bigger than a little finger going in. So I can't see.
I suppose it's a
Tony,
it's a
unfounded fear.
But Tony, take it from me. I mean, look, it is a bunch of nonsense. I mean, look, Dr. Goetz spoke just now about the PSA test. I did an interview during CPL with Pete Russell, who is the CEO of CPL, and Pete's PSA was 2, and he just happened, because he had private coverage, went and did a scan, and he had cancer and he had to have surgery. And it's a very complicated thing, and it requires a very holistic approach, including the PSA test, your digital rectal exam. But listen, I mean, for those out there who are listening to it, who are thinking all these things, because there have been so many advances in terms of the treatment of prostate cancer, now you want to catch it early. What you don't want is someone to look you in the eye and say to you, Breds, you have prostate cancer. It has metastasized into your liver and your bones, and it's 3,000 PSA, and you probably have a couple of years left. At that point, nobody's going to be thinking about that digital rectal exam. And that's what you have to think about. Those are the choices that you get to eventually,
Correct.
So it is a very real thing. This is cancer. It can kill you. Stop the nonsense. You're talking about your lives and the lives of your family. You're going to leave your family behind. You're going to find yourself in a situation where, you have limited time left. So trust me, at that point, if someone looks at you and says, Brez, you have really advanced cancer, that digital exam doesn't mean anything at that point.
Just before, as I indicated at the top of the program, Dr. Goetz has to leave at 5 o'clock. So, Charlo, if there are people who want to call in, and of course, we will have Sunil with us after the 5 o'clock time. If there are people who want to call in and get some advice and get some direction from Dr. Goetz and Sunil too, who has the practical experience of having the prostate cancer. So let me turn it to you to give our listeners an invite to call in and talk with Dr. Goetz and Sunil Ramdeen.
No problem. So people, you can give us a call right now. The lines are open to you. We can take your messages on 2811315. That's 2811315. If you are on your WhatsApp, you can send us a WhatsApp message, and you can also message us via our YouTube chat also. So once you get the messages, I'll let you guys know, Tony.
Okay, great. Dr. Goetz, you were going to say something.
I was just going to say that the reason we make a big deal, just as what Sunil has said, about prostate cancer, it is a very curative cancer.
Okay.
I can tell you the first patient we did curative treatment for was in 1998, Mr. James. How many years ago that was? I can't remember. But in 1998, he was treated, and he came to my office about a few weeks ago, Mr. James, and he came just to knock on the door and show me that his PSA is still 0. Right?
Okay.
Yeah, and he is
that he's alive and well.
Yeah.
Very much. You're walking faster than
That's
I
amazing.
am. Yeah, so
I mean, I've been
curative.
fortunate as well.
So that is the only message you should be given. This is curative if it is caught early. If it has already started to spread to the bones and you become paralyzed and you're wearing pampers and you're bedridden, that is too late. You know, and here's a treatable, curable cancer that nobody should be dying from prostate cancer. People should not be paralyzed. I mean, we have people coming with back pain running down their legs. When you check, the cancer has already gone to the backbone, and that is too late. Some people, their parents had prostate cancer, and all they're reaching in their 70s now checking, or in their 60s now checking. Your parents had prostate cancer at 40. You should be checking that. You shouldn't be hesitating, you know, because they get it younger. The genetic is the people.
Dr. Goetz, I know that there have been some advances in terms of the techniques used to do the operation. So if you can give our listeners and viewers an appreciation of that, maybe that will cause some of the fear to drop away from taking the operation when necessary.
Well, there are three curative treatments. One is the operation, which we call radical prostatectomy. The second one is external beam therapy, which is radiation to the prostate. And the third one is brachytherapy, which is putting little seeds which is like an injection into the prostate. So all three give the same cure rates. Long ago, external beam therapy was not a good option because they had these old cobalt machines, which nobody has in Trinidad. We now have high-tech linear accelerator machines, which give you very accurate and precise radiation. So we have people who've had radiation since 2001, still alive, still PSA, still 0. Brachytherapy came to Trinidad around 2000. That is giving good results. The one guy just came back. He's 93 years old, and his PSA is still 0. And he had his brachytherapy in 2001. And radical prostatectomy is the third option. So they all, which is surgery. If you want to look at the improvements in terms of the surgery itself, a number of things. We had to bring in professors, both from the States and from England, to teach us nerve sparing, where we push aside the nerves, and these are the nerves for erections that run just outside the prostate and go to your penis. So long ago, we didn't know where the nerves were, and then people did the pioneer in this was from Johns Hopkins University in the States, and he found out where the nerves were located. And now we are able to move the nerves aside, so to give you a better chance to get erections after the surgery. The second big improvement with radical prostatectomy was to get a long length of the urethra, which is the passage where the urine comes through. So we try to shell out that passageway, separate it from the prostate, and people have better control on their urine, so you don't have the incontinence like you used to have long ago. So from those two aspects, the surgery. The brachytherapy has also improved, where you put seeds in the prostate because of computerization. The computers now calculate how many seeds, how far apart, where to put it, where not to put it, gives you a whole map. So the end results are much, much better. Where before we only used to do low risk, now we're doing intermediate and high risk with hormonal therapy. And the same thing with external beam, that has improved dramatically. I remember when the first time we sent somebody for external beam, the people in the National Radiotherapy didn't know what the hell we were talking about, you know? We say, yeah, that is a treatment for prostate. They say, what is that? We don't do that. And then eventually with having started to read and do research and harass them and harass them. So now that has become a routine part, and the quality of result, the quality of care that we get is so much better than 15 years ago.
Okay. Does a patient after an operation have to spend, an extended period in hospital, nursing home, whatever the institution
No.
is?
If I do a radical prostatectomy today, 9 out of 10 people will be home tomorrow. You see, because it doesn't go into the peritoneal cavity, it goes behind the peritoneum. You don't have the pain that you would have with regular surgery. So most people will be up and about. The most somebody else will stay is another day. But once the patient's drain has stopped draining, that is usually happens within 24 hours. And they're up and about walking, you can go. Brachytherapy, you go home the same day. External beam is a little longer. Brachytherapy is outpatient. You come in the morning, have your seeds put in the prostate, and by lunchtime you are home. External beam is a little longer. You have to come Monday to Friday for 10 to 15 minutes, have the external beam therapy, and that goes on for around 5 weeks. They don't do it on a weekend. So they have different side effects. Is different for each treatment, but the end result is the same identical cure rate. So if you look at the international guidelines for curing prostate cancer, it is brachytherapy, seeds into the prostate, radical surgery, or external beam. Those are the three.
Can you, Dr. Goetz, explain a little bit? I'm curious about the seeds therapy as you talk about it. What is it exactly?
You see, to do a biopsy, you take out tiny pieces of the prostate and send it for testing. With seeds, you're actually putting in seeds into the prostate. So it's very similar. It's an injection into the prostate, and depending on the size, you'll be able to calculate how many seeds. So the bigger prostate, you have to put more seeds. The smaller prostate, you put less seeds. So it really is an injection. That's why there's no pain, no bleeding, no catheter, no tubes, and all sorts of things that you have.
What about, Sunil, I'm not leaving you out. I'm just utilizing Dr. Goetz because he has to leave in a short while. What kind of frequency do people come in and test for prostate? They're having problems of what kind of the other, and perhaps like Sunil, they don't even know what the problems are. What's the kind of frequency?
That is actually the most common way for patients to come. They have a difficulty, they're forcing to pass urine, the urine is slow, getting up at night, going very often, they have to go right away, they can't hold it. And then you say, well, maybe there's a problem with the bladder, maybe there's a problem with the prostate, let's check it. And that is how you pick up. Sometimes they don't know they have sometimes it's not a cancer at all, it's just a big prostate blocking the passageway, but you have to rule out a cancer because that is curable. I think that is the main message you have to say. It is a curable cancer, and people are living more than 20 years now who were treated 20 years ago. So there's no excuse for picking it up too late. It means you didn't see the seriousness of it. The most common cancer. When people have prostate cancer, we advise them on diet because the lowest cancer in the world right now is in Japan. But the Japanese, when they go to America, all of them get prostate cancer. And for years, people couldn't figure out why the Japanese not getting breast cancer, they're not getting prostate cancer. But the twin brother goes to America and he gets cancer. Twin brother in Japan, no cancer at all, identical twins. What's going on? And then they realized that the diet had something to it, because prior to that, they tested the air, the water, the soil. They couldn't find out what was causing the Japanese to get cancer when they go to America. And somebody said, test the diet. But nobody tested food. I mean, you go to Maracas, eat bacon shack. Nobody tests bacon shack. Nobody tests doubles and pilau. We just eat it. That's how we eat. In Japan, they eat sushi, right? So sushi is fish. And when they go to America, they say, well, we're in America. throw away that stupid sushi. We're going to eat American food. And what is American food? Bacon in the morning, KFC lunchtime, steak in the night, hot dog, hamburger, beef, pork, goat, duck, lamb, chicken, cancer. And then they started to realize that it was the animal fat. So those things walking on the ground with legs are the ones that stir up the prostate cancer. And the things that swim in the sea are the things that kill the cancer cells. And it was a very dramatic recovery. So we now tell patients to eat more fish and less meat, right? For those who don't like fish, we tell them eat pure omega-3. Don't eat 3, 6, and 9 because this omega-6 makes the cancer worse. So we now tell patients stick with pure omega. Don't mix it with omega-3. It is easy to remember. You're all watching cricket. It only have 3 stumps behind the batsman, right? It have 6 stumps. It's 3 he batting and only 3 behind him. So remember omega-3 as an alternative to fish. But the oily fish are the ones that seem to have helped the prostate, like salmon, tuna, herring, mackerel, sardine, that kind of thing. And then we talk about vegetables, and the vegetables that seem to have, that were tested, broccoli is one, tomato is one, and recently they found that pepper has a substance called capsaicin that kills the cancer cells. So we encourage people to put a little pepper in their food as well.
That makes me happy.
Yes, very happy. Yes, I know that, Tony. And then in terms of fruits, watermelon and pawpaw seem to have come out as the 2 best fruits for prostate. And then olive oil seems to have a suppressing factor. So in terms of diet, yes, you can change your diet. Give the meat to your enemies and you eat the fish, fruits, and vegetables and provision, right? So
all right.
basically...
Yeah, so we are still, Chalu, we are still inviting our listeners, our viewers. Don't be afraid. Dr. Goetz won't perform any operation on you via
Not
the
at
video. So call in and talk with him, talk with Sunil, who has had the practical experience of having the prostate cancer. And it can probably save you from going down that road. Just before you go, Dr. Goetz, what else can you share with our listeners and viewers?
Well, in terms of, so we have improved our treatments for the complications of surgery, right? We don't see as many complications with brachytherapy or external beam, but surgery can have 2 main complications. One is incontinence, which usually resolves itself after some months. But if it doesn't, we have the treatments now available in Trinidad, what we call artificial urinary sphincter, which is like a blood pressure cuff, but it goes around the urinary passage. So you can stop leaking. You don't have to be leaking urine at all. So that is now available. And that's good news. So people who are wet and wearing Pampers are now dry. And the second option, the second advance was for erection problems. So if the nerves are injured, which is going to the penis, then the tablets will not work, like Viagra and Cialis will not work. But what we have is a trimix, which is a mixture of 3 things, right? And papaverine, phentolamine, prostaglandin E1. And these 3 things can increase the blood flow to the penis and will bypass the nerves. They will act directly on the blood flow, and that gives an erection after surgery. So you have treatments now available in Trinidad for the complications, where previously we didn't have anything. We didn't have any sphincters, and trimix is fairly recent. So I think from that point of view, these things may not happen. Some people are dry, some people don't get erection problems. But if there's a complication, we can treat the complication as well. So that is good news for treating it.
Right.
I have Tony, 1 minute. I have
one. You have a caller.
I have a message from one person who was asking, if the surgeries that the doctor was talking about, the different types of surgeries, if they are available in our public healthcare system, and how safe are they?
Yes, the radical surgery is available. External beam in the public sector, the National Radiotherapy does that. Brachytherapy, we had a period in the public sector where that was available for a few years. But at this point right now, brachytherapy is only in the private sector. Yeah, but insurance, the people who have insurance, they get very good coverage for these treatments if they want to go privately.
And actually, Dr. Goetz, I was going to ask you a question along those same lines. You know, sometimes we in Trinidad and Tobago, I suppose it's a small island culture. We believe that we don't believe that we have the capacity amongst the doctors, the nursing homes, the hospitals, and so on to deal with something like prostate cancer. How well, and I know that you've been to several over many years, international conferences and experiences abroad, all over the place. How well do we stack up our institutions and our medical doctors, like your good self? How do you stack up with those external capacities and institutions?
Well, that is a challenge. You know, the Minister of Health spoke to me recently and asked if I could give suggestions to improve healthcare in the public sector. And, you know, one of my first suggestions was to have exchange programs. So what I meant by exchange program, we take key people from Trinidad and let them go abroad and get exposure to the systems there, and get those people from abroad to come here and see what problems we have in Trinidad so that they can give us suggestions. And that has proved, we've done that in the past, and they need to continue doing that, because that we just moved into a different era. The minute you see we go there and they come here, we exchange ideas, bingo. Some of these things are very simple, not expensive, but the systems are not in place. And that is what we can benefit from. That is, for me, the most important way to improve healthcare in Trinidad. The other thing is that, you know, we may have to do something if it becomes unaffordable. Because what they have done in Jamaica, patients who have had surgery, they found that the thing that cost a lot is replacement, disposable items in healthcare. So if you used IV fluids, you have to throw that away when it's finished. When you stitch somebody, that thread, and then you have to buy more, right? So we haven't had systems to put funding for replacement therapy. So if something goes, it's gone, and that is it. We don't have money to buy anymore. So we have to look at our statistics, look at our figures, what is the need and what we need to budget for in a year. You know, and if we're going to be doing 100 appendix, and each time you did an appendix, a bandage has to be thrown away, we have to buy a new bandage, sutures, we have to buy new drains, and so on. So it's about forward thinking. So we don't just go along merrily, and, well, if we have it, we don't have it. There should be better planning in terms of looking at figures. In healthcare on the whole, everything has to be audited, and that is how we got to find out overcrowding was in the hospitals was really due to patients who had strokes and who were waiting on dialysis. So a stroke patient is lying down in a bed for weeks and weeks and weeks, and when you come with your heart attack, you can't get a bed. And a stroke patient, after initial admission, once he's stable, should be going to a rehab center. Look, Patrick Manning had to go abroad, our prime minister, to get rehab. We have no rehab center in certain parts of Trinidad. Why do we have to send him abroad? We should be doing that here and free that bed. So that bed will not be occupied for weeks and weeks. That patient would go to a rehab center. Same thing with dialysis. You have people waiting weeks and weeks and weeks, and they lie down in a hospital bed. They should be in a dialysis center immediately. And there are things like that. What you mean is that is coming from research. If you do the research, you get the idea where the problem is, And same thing with long people waiting long for surgery. 75% of your operations are day surgery. You operate in the morning, they go home in the afternoon. And we have no day surgery units in the major hospitals. So there, it's called planning and thinking out things, but you need people to advise other people to go that direction. And then you'll see the difference in healthcare. You'll get your operations faster, you won't have the overcrowding. Two of the key issues and simple solutions.
Right. Dr. Goetz, we want to thank you very much for your time, your expertise. We don't want you to be late for your meeting, so we thank you. And perhaps at another point in time, because information is always important, education is always important, so that you don't wake up one morning like Sunil Ramdeen and see this situation in front of you.
He's very lucky. He caught it in time. So my takeaway message was that prostate cancer is curative. There's a strong genetic. So if you have cancer, tell every man in your family, do your PSA at 40. So all men in Trinidad should be checking their PSA from the age of 40. Don't wait till 50. That is
right. Thanks again, Dr. Goetz.
Thank you.
All right, so Chalo, let's take in some messages at this point, and then we come back to Sunil Ramdeen, who is going to be available for the next hour, talking his situation through. He has also written a book about it, and I'll ask him to tell us something about some of the things that he has said in it. Remember, of course, his background is as a journalist, so he's a writer, and therefore he has put it down in a text so that we can be informed by it. Chalo, we come back in a moment.
Wake up with the NETT Radio Breakfast Show. Rise and shine with Wendell Stevens and Richard Raghubarsingh, weekdays from 6 o'clock to 9 a.m. Start your day feeling good, energized, and informed as we tackle the biggest issues of the day, get you where you need to be on time, and keep you in the know about everything that matters. We bring you insightful discussions, expert analysis, and the latest updates so you're always ahead of the curve. Mornings matter. Your voice matters. And it all starts right here on New Era TT Radio, NETT Radio. The NETT Radio Breakfast Show, weekdays 6 to 9 a.m. Wake up informed and stay ahead.
S&H Rumbox, 137 Western Main Road, St. James, for all your retail and wholesale needs for alcohol and non-alcoholic beverages. Call us at 686-0599 or visit us at 137 Western Main Road, St. James. S&H Rumbox, drinking out of the box.
Advertise with us on New Era TT Radio, the fastest growing streaming platform for talk in Trinidad and Tobago. Audio and video ads welcome. Elevate your brand with us. Connect with us at newerattradio@yahoo.com or call us at 299-5156. Now what are you waiting for?
Bringing you full discussions, the hottest topics, and some tracks to keep you moving. The Drive Time Exchange on NETT Radio, taking you above and beyond.
So you want to love my country forever, yeah. My sugar island, sweet sunny island. My homeland is sweet for soul. Island, my sugar island, sweet precious island. I would never let you go, no. Sipping 1919 and gas to ride. My sweet for soul. Island roti, rice and coachella. Yeah, sweet for soul. Curried wild meat mixed like hot pepper. My sweet for soul. Pure and healthy coconut water. Come for holiday. Get some for
right, everybody. Good afternoon to you once again as we welcome you inside the second hour of the Drive Time Exchange. Remember, you are listening to New Era TT Radio. We stream all day, every day. So you can get us on newerattradio.com, New Era TT Radio on TuneIn. So you get us on Alexa and, of course, all of your Google devices. And, of course, in the morning time between 6 a.m. and 8 a.m., you can get us also on Gael Caribbean now. So, number of ways that you can get us. Just get us, all right? So, we welcome you back to the Drive Time Exchange. Tony, it's back to you. I think your mic is muted.
Sorry about that. Yeah. Okay, so we are back on the program now, and we still have Sunil Ramdeen with us, somebody who had the prostate problem some time ago and survived it all and talked about it and wrote about it. Incidentally, somebody sent me a message when Dr. Goetz was on the program. You didn't want to send your message, now you're sending it to me to find out something about him. As I can tell you, he has his private practice in the Gulf View area in San Fernando. He also functions in St. Joseph at the Medical Associates a couple days a week. And so you can contact him, look up his number, probably in the directory. Not that we have directories anymore, but I'm sure that if you Google him, you can find a way to get in touch with him. So you can visit him if there is a requirement. So I want to go to Sunil Ramdeen, my colleague and fellow journalist. He has left the poor man's profession behind and gone to a higher level now, but he's still my colleague. So, Sunil, first of all, you've talked about how you got diagnosed with this thing. Inadvertently, you didn't go there for this particular situation, but it came out to be like that. You've talked about that. What about the time in between? And I presume there was a period of time in between finding out about your condition and getting the operation. Was it normal living? Was it filled with pain and fears and all of those things?
I mean, when somebody says to you, so initially, when I got the Gleason scores in, and in researching it, I realized how high it was. But I thought at 49 years old, it's probably early to intermediate cancer and that I would be able to deal with it. When I found out the stage that it was at and the Gleason levels and how aggressive it was, that really knocked me back. And I think more than anything else, with no prior notice, as Dr. Goetz rightly said, it's something that's hereditary, but with no prior notice, it really was a shocker. And there are lots of things that you go through at that point. There are lots of things that are mental. It's your family. It takes a spiritual toll on you as well. But he made another very important point in that it's a cancer that is not the fastest moving cancer. If you catch it in time, it's a relatively slow moving cancer, which is another reason why you want to pick it up early, because it's very treatable. And, I remember when I contacted the surgeon, because I had to go straight to surgery because of how aggressive it was. I had radical prostatectomy. Mine was robotic. So there was thank God there's very little.
Sorry, Sunil, were you in Trinidad at that time or were you abroad?
I was in St. Lucia when I was diagnosed. I had my surgery done in Orlando.
Okay.
A friend of mine who is oncologist out in Chicago, he said, look, he would try to find some of his contacts, and he had this contact who was in Orlando Advent Health, which turned out to be really, really fantastic place. It's called the Global Prostate Cancer Institute. Dr. Vipul Patel was the actual surgeon. He'd done at that time, I think, over 50,000 robotic prostatectomies. So he was very well versed in it. And my surgery, I was diagnosed in like November. My surgery was set in March. And I was like, wow, like that's a long period. But during that period, I did what Dr. Goetz talked about. Diet is really important. I had to change my diet completely. Gave up red meats, things like that, totally switched to cruciferous veg, more fish, fruits, things like soursop as well, a lot of seeds. I used a lot of pawpaw seeds, actually. Pretty good. A lot of pomegranate juice, which is very, very good. So I switched to a strong diet because, I told a very few people, and one of my colleagues said, listen, you just need to get strong for the fight ahead. And that sort of fortified me. Started exercising. I dropped 25, 30 pounds, changed my diet completely. So by the time I got to my surgery, I was actually probably much healthier than I had been for a long time.
Was there pain in that period before the surgery took place?
You wouldn't have a clue. I mean, you wouldn't have a clue that anything was wrong with me. And that's one of the dangers of prostate cancer. I was fine. I was functioning normally. The only thing really continued to be that frequency of urinating in the night. But beyond that, I was fine.
Okay. All right. So, Sunil, you have written a book on the matter. Perhaps you can give us an insight into the things that you cover in the book, and feel free to put up your book on the screen. As I indicated to you, Chalo won't send you a fee for free advertising. So go ahead, but seriously, go ahead. Go through some.
Yes, so this is actually the book. It's called Chosen, and there's a long story behind that, and it actually outlines my personal journey from discovery through the entire process, because it's a lot to take in. I mean, one, the diagnosis; two, dealing with the lack of information that is out there, that I had to go and research on my own, access to information. It's dealing with all the mental struggles, all the financial struggles, everything else that comes along with it. It's dealing with the actual process itself, going through the process, having to deal with the things that Dr. Goetz spoke about, like ED, incontinence, all parts of what you have to cope with, which you can cope with in terms of the surgery. So it really is a very personal journey of mine, going through the entire process, from diagnosis, the entire process, the physical changes, the medical changes. And it became very much a spiritual journey for me. I mean, it's something that it really changes everything about you. It changes the way you think. It changes the way you approach life, the way you approach people. So it's called Chosen. It is a funny little story, I remember I had a really, really, really bad day. I mean, I think I did my bone imaging, because you have to go through a lot of tests before you do surgery. They put you through a lot of tests. You have to do a CAT scan, you have to do cardiac tests, you have to do MRIs, you have to do imaging. So they want to see if the cancer spread and how far it spread, if it has. So I had to go through a lot of those things. And I remember there was one day I done the bone imaging test. I come back to Trinidad to do it. And, I was in a really low place. And I remember, just hearing this voice in my head saying to me, listen, there's a reason you're going through this. And it's because, this is something that you need to speak about. You have a story to tell, and you need to conquer this, and you need to tell that story. And I think at that moment, my entire approach changed. I really, really focused on the fact that, I was going to overcome this, because I found that most of the people who've overcome cancer had an absolutely positive mindset. And I think that is really important.
Yeah. What of your work in that period of time? Were you able to continue at your job?
Yeah, I worked as normal. The truth is, a lot of people never even knew what I was going through, because it really was, there was no major change in my physical appearance, other than I was losing weight, I was looking healthy, and that could have just been a lifestyle choice. But I was working as normal. It is only within the last few months, a lot of people have even found out, and that's because I've started talking about my journey. I've started promoting the book a little bit. I've not launched the actual book as yet. Like I said, it's called Chosen. It's on Amazon, so you can go on Amazon and order it. But I would love to come to Trinidad and do it. I've had a conversation with the Ministry of Health, going back to what Dr. Goetz said, in terms of it's something that they should be involved in. So whatever I do, I want to make sure that they do it. And it really was initially notes that I was keeping. And the funny thing is, it actually became a book because I was chatting with Sunati Maharaj, who's another colleague of ours. And Sunati is a very strong advocate, as you know, of all these things. She's had a personal experience as well. And she said to me, listen, you need to take those notes and you need to put them into a format that people can access the information.
Mm-hmm. Okay. So going through the book again, what are some of the chapters and what they deal with in terms of enlightening people as to, be aware of this disease?
A lot of it really has to do with a lot of the taboos. It was a very personal journey for me. My dad died from cancer, and it was, he had cancer in his stomach. I had no idea that whether there was any history of prostate cancer in my family. After I was diagnosed, I understood that an uncle of mine in his 70s actually contracted prostate cancer as well, but he's fine also. But, it is really dealing with the challenge I had accessing information. And then really dealing with a lot of the stigmas and taboos that we started talking about earlier. There's this very how to put it? You said this macho sort of approach, this concern that it's something that people laugh at and it's something that people make jokes about, and you go for your prostate cancer test, and it's the easiest thing in the world to make a joke about, but it's a very serious thing, and it's really, in going through the book, I explore some of those things. I try to speak very openly about them, about my personal experience. I try to speak very openly about the challenges that I had to face. I had to actually begin doing exercises, because one of the things that I found out is that there are 3 sphincters that control urinary flow. 2 are located in the prostate, and 1, which is located outside the prostate, you hardly ever really use. And I had to start undergoing exercises to strengthen that sphincter, so that when the prostate was actually removed, that controlled. So I moved from 3 to 1 to actually control the flow. And, that is one of the things I had to deal with. I spoke very openly about, having to wear a catheter. I spoke very openly about the incontinence and having to use adult diapers. I spoke very openly about the whole question of ED and how you approach it. And the fact is, as Dr. Goetz said, these are challenges that you can really overcome. I mean, the information is there, the advances in medical technology is there to help you overcome them. They're real challenges. They're scary things, obviously, for men in particular. But there was nothing more scary to me than losing my life, than, leaving my family. That to me was scarier than everything else.
Mm-hmm. So I presume you went through a lot of psychological pressure at that point in time. Just in addition to all of the physical elements of the thing, you had to deal with the psychological pressure, as you indicated. One, I suppose there is still stigma associated with any form of cancer. You still hear people talk about cancer. It's a death certificate for you, and by getting cancer, you somehow you did it to yourself, and there's some difficulty in your whole lifestyle. I suppose all of those things impact on you in that period.
It was. I mean, I just want to read one paragraph from the book.
Sure.
For you. It was when I learned from the urologist how aggressive the cancer was, and this is taken from the book. It felt like someone had plunged an icy dagger into my gut and was slowly twisting it around and around, even as my face burst into perspiration from a sudden and unbearable heat on the outside. In an instant, I was bombarded by a range of emotions: disbelief, fear, anxiety, anger, despair, and confusion, all mixed with the realization that everything I had planned, all my hopes and dreams, had just come to a crashing halt. All the things I thought were important, things that I had prioritized before, evaporated into an emptiness. And I mean, I think that is something that you experience with any sort of cancer. And I think the point we really want to drive home is, with prostate cancer, you don't need to get to that point where I was to have to go through that. If you screen, if you test, if you take the advice of Dr. Goetz and test early, if you have a history of it in your family and you go and test it, you don't need to get to that point. It can be treated, and you can avoid a lot of the things that I had to cope with: ED, incontinence, the surgery, and very importantly, I had radical prostatectomy. So basically at 53, I now know I won't be having, not that I plan to, but there's no more having kids ever. And I had that surgery at 50 years old.
What about your life subsequent to the operation? How has it been in terms of coming to terms? Well, first of all, answer the question whether there are any physical elements left over after the operation from the prostate cancer.
The main thing you really have to deal with is the fact that your prostate is not there anymore. The good news is that, with the right exercises and medication, you can get dry, as they say. And I did that pretty quickly in terms of getting past the whole incontinence thing. It is just when you have to actually deal with it, Tony, when you're put in a position where you have to actually go and get the adult diapers, and you go through a period of weeks having to do it. You don't really care, it's just something that you have to do, and I just made up my mind to get past it. So I actually got past the incontinence pretty quickly. Because I was at a younger age, I was able to get past the whole ED issue relatively quickly as well. And, I suppose that was a matter of age as well, in terms of really having just really good medical advice. But beyond that, maybe I'm healthier than I've been because I've changed my diet. I've completely dropped things like red meat. I've reduced my sugar intake, really started to exercise, which is very important. I mean, if you're recovering, they tell you need to exercise. In fact,
Sunil, sorry, before you go on, I think you've just said 3 or 4 things here which are vitally important, and I want you to go back over them. Your diet, your lifestyle, and so on. Go back over them with a little bit more detail so that our listeners, our viewers can get an appreciation of how you have to change your lifestyle to survive after the operation. Go ahead.
No, absolutely. Even at this point, if you've not been diagnosed, your diet can impact and help control your prostate cancer. And there are things that Dr. Goetz pointed out that contributed. Red meats, a lot of meat contributes to a more aggressive, allowing it to spread. You eliminate these things. There are things that you can look at that help control the spread of prostate cancer. Things like cruciferous veg, things like broccoli, cauliflower, carrots, tomatoes. I found in my own research that soursop is actually quite good. Pawpaw seeds are actually quite good as well. Pomegranate juice is pure pomegranate juice is fantastic. These things are all really high in antioxidants, and they help control the actual spread of it. So I really had to change that, and then I started exercising every single day, because exercise is also really important.
Before you go on, we're going to deal with the exercise after this question and your responses. It may feel, I am a meat eater. I love plenty meat, all kinds of meats and so on. And I don't know if I feel I could survive without eating meats and all of the other bad things that we partake of. I don't drink alcohol, never was an alcohol drinker, so that's not a problem. But how do you, I mean, I'm sitting here and listening to you and I'm saying, I wonder if I could stop eating all this meat that I eat. I mean, how did you deal with that?
It becomes something that you have to do. I mean, listen, I cook a good duck. I enjoyed a good steak as well. I grew up next to one of the finest roast pork places in Trinidad, Keps up in Princestown. So just like you, I mean, I enjoy a good meat as well. But it just becomes something that you have to do when you begin exploring different things and different options. And it gets to a point, certainly I did. And again, that's a personal experience. Certainly I did where I really don't miss it. And the truth is that now, if I would probably have a single piece of something just to taste what it is, but I really don't miss it. If people look at me and, they look at my diet at lunch. I'm usually full of vegetables, hardly ever take meat sometimes, and it's just something that you get used to. It becomes medicine in a sense because, when I eat now, I really look at everything I put into my body and what value it adds to my body. So eating has become like that for me, really.
There is a biblical verse somewhere. It can't come to my mind immediately, which shows I'm not a good Bible-toting person about the things that really, but the things that you put into your mouth are the things that defile you going forward. So obviously that is something else. You were going on to talk about another aspect of the life after the surgery.
Yeah, and it's exercise. I mean, one of the things that and the great thing is the hospital I was with, they have excellent follow-up, and outreach and after patient care service. They always have seminars. They always send you information. One of the things they talk about is exercise. Walking, simplest exercise is walking. You get 20 to 30 minutes a day. That's important. But what I found is strength exercise as well. There's something about, working out. I go to the gym. And I was reading somewhere, and I've read so many things, since I've embarked on this journey, where strength conditioning, and there's something in the muscle that an enzyme or something that's produced that actually is very good in terms of helping to control cancer spread. And so I combine my exercise both in terms of aerobic exercise with strength training exercise, and it just makes you healthier. It helps with the other lifestyle diseases as well that you may be faced with.
What clearly, Sunil, you have taken this thing seriously after the surgery, before and after the surgery, and it has become something perhaps of a mantra that you feel obligated to talk about and write about and so on. Has it been impactful in terms of your relationships with other people? And by relationships, I mean any kinds of relationships, casual relationships, people. How I knew about your condition was that interview you did with the, what's his name, the CPL director.
Pete Russell.
Yeah. I did an interview with him a few years ago, actually. And yeah, well, of course, I didn't know what his condition was. But is there a compulsion in your life now to talk about this thing as a way of perhaps preventing other people from walking down that road? And if they do, then there is life after it?
Yeah, there absolutely is. And I think in setting out on this journey, that is something that I wanted to communicate. I would never in a million years have thought that I would have to deal with this. But, in terms of having to deal with it, the research that I've had to put into it, there's some very strong messages that I want to repeat again. One is that this is not an old man's disease, as sometimes we think. The surgeon who I had to deal with had treated over 5,000 people, and that was 3 years ago, who were under the age of 50 with aggressive prostate cancer. So this is not an old man's disease. Unfortunately, you know, a lot of the guidelines out there as well, medical guidelines, they push back testing and they push back the conversation closer to 50, even though, you know, I know Dr. Goetz said at 40 years old, but sometimes, you know, you go to a personal doctor, whether it be coverage or whatever, whether it be people's own insecurities about it, they push it back and push it back. With this disease, every month, every year makes a huge difference. And the sooner you get it, the better. And the easiest thing to do is your blood test, your PSA screening. And I've talked about all of these things in the book because I had to learn about them. I've talked about what the PSA is, prostate-specific antigen. It's produced by malignant cells of the prostate, as well as normal cells. I've tried to break down all the information in terms of the tests that are available, in terms of what you need to look for, as you said, Tony, in terms of the possible symptoms, in terms of the things that I've experienced, in terms of what the conversations you should be having with your loved ones and the conversations you should be having with the extended family. So I've really tried to, much of what we've talked about this afternoon, put into this book. Again, it's a personal journey. It's my personal journey, so it's not a medical book. You know, I urge anybody who is reading it to take it for what it is. But, you know, I really hope that my personal experiences and sharing with them what I found out, and I've been able to share this book with a lot of people, you know, and I was absolutely stunned to find out how many people are actually suffering from prostate cancer. Right. People within my own circle, so I didn't even know. Friends, colleagues, work colleagues. Yeah. I was shocked. And, you know, I was able to share the book with them. A lot of them weren't able to have access to the information I did. And I would be talking to them, did you do this? Did you change it that? Did you do this? And no. What about this? Did you start using this? Not really. I didn't know about it. I was like, oh my goodness. And, you know, for me, the book it's about getting information out there. And I hope it's about saving lives. You know, it's not that I wrote a book and I wanted to sell. I've given away quite a few of it, to be totally honest, because it's really important for me, I think, in terms of what I went through, not just physically, not just mentally, but spiritually as well. I mean, I remember at one point, Tony, and, you know, people can look at this in whatever context that they want to, but you know, I remember after the surgery, my surgeon saying to me at one point, because of how aggressive it was, he says, look, we can only hope now as we go forward. And at that point, it was out of the hands of man. You know, it was in the hands of somebody else. And I've actually seen, and I've talked about it in the book, really things that really make you question and talk, and things that I've personally witnessed that I've talked about in the book as well. It's an amazing journey.
Mm-hmm. Obviously, you don't feel that stigmatization which goes with certain diseases like cancer. If you have cancer, you've done something wrong with your life. You have some kind of jumbie inside of you. You are marked off. You know, these things, they don't come to the fore and be articulated real, but that's how some people think. They may even think. I remember, Sunil, when the HIV and AIDS epidemic was sweeping the world and right through the Caribbean, and I worked with Jones Madeira at that point in time. He was working at CAREC, the Caribbean Epidemiology Center, and even more than cancer, having HIV and graduating to AIDS, that was a real stigma. You saw somebody, he did something wrong, God treated him with this thing. He's a man marked off. We traveled through the Caribbean talking to reporters ourselves how they should deal with this thing and not report on it as if it's you know, a devil fall down from heaven and drop in your yard, because how did you clearly now there is no stigma that you are afraid of, because you've gone public, you've written a book, and you are now coming on the best radio and television station in the Caribbean to talk about it. So
That's right.
So clearly there is not that. How did you deal with getting from the initial stage to the stage that you're at now?
Yeah, so it goes back to that single moment that I had. Call it an epiphany, if you will. But I took the opposite. I initially I felt that way, Tony. Initially, I felt like, how could this happen to me? This happens to somebody else. Where did this come from? And then it got to a point where all of that kind of changed on its head, and I said to myself, you know what? This happened to me for a reason. This happened to me because I could carry it. This happened to me because I have the strength to overcome it, and I have the ability to share the information and speak about it because of my background as a journalist. And I said to myself, I'm going to and that's where the name of the book came from, Chosen. I said, you know what? He gave it to me because or whatever. I had it, saying he gave it to me but I said, look, this happened because I could deal with it. I could carry it and I could overcome it. And my job when I overcome it is to tell people about it, is to talk about my experience, is to do all that I can to save lives. Get rid of stigmas, get rid of taboos, try to have men have an open conversation about this, and that this is a good news, bad news thing. Bad news is if you really wait and you're diagnosed and it's bad. Good news is if you catch it early, as Dr. Goetz said, with the advances made, it's treatable.
Okay, so Chalo, let's take a break here, and you can give out some more messages as to how people can get in touch with the station and what we do and all of those things. And then we come back to finishing off the conversation with Sunil Ramdeen, who is somebody who has gone through the operation for prostate cancer, survived it, and is living now to tell his story in significant ways to help a lot of people who may feel somehow about checking for the possibility of having the disease. Over to you, Chalo. Chalo must have stepped out for a moment. So let's continue to chat while he comes back to the platform to allow our viewers and listeners, if you want to call in and talk with us or send us some written information, Chalo will give you the information on that and so on. Okay, so in this period of time now, Sunil Ramdeen is the person that we're talking with. People who looked at television and read newspapers 20 years ago, Sunil, perhaps less than that, would know the name and would know the personality and so on. And he has talked about his life with prostate cancer, the problems that he experienced and the operation that he had, and living the life thereafter, and wanting to talk about it, Sunil, to assist persons who, and as you indicated, there was no indication on your part apart from frequent urination, and a whole lot of people suffer that without having prostate problems. So there was no indication that you had this thing, and therefore you were living a normal kind of life. How's it been thereafter in this period of time? Are you talking to a lot of people? You're stationed where, in St. Lucia?
Yeah, I'm stationed in St. Lucia. And, yes, in fact, I've joined together with a lot of folks in St. Lucia. One of the leading doctors in St. Lucia, Dr. Stephen King, the CMO in St. Lucia, the St. Lucia Hotel Association. And I'm with Sandals now. I'm the regional director for PR and communications for Sandals. And the hospitality industry is a large employer in St. Lucia and throughout the rest of the Caribbean. And, in talking about it, the St. Lucia Tourism and Hotel Association, they've been very proactive. They've actually acquired several copies of my book to share with the members. And then I've gotten together with Dr. King and another group of about 4 or 5 advocates in St. Lucia. And we've worked with the Ministry of Health. We've worked with something called the Tourism Enhancement Fund, where we've given away vouchers for persons to go and get free PSA testing. And we've had to do that here. I think PSA testing might be free in Trinidad, just to start encouraging people to take this seriously, to go and get tested, and to begin the process. So, we're trying to be very active. And there's something else that Dr. Goetz mentioned. There's insufficient research done in terms of the causes. He talked about diet just now in terms of genetics. So what we're trying to do is gather information as well. And I think there's a study that's going on right now based at UE, where they're collating a lot of this information, and they're going to build a proper profile, which will allow people to look at, whether they're geographic areas, whether, looking at possible factors that may contribute more to where you see incidences of prostate cancer.
Mm-hmm. Sunil, I must say that you've taken this thing on seriously, stronger perhaps even than cricket. I listened to
I don't know if that's...
No.
Well, you see, I brought them both together the other night, right?
Okay, right. Yeah, but seriously, you've taken this thing, I suppose, for the ordinary kind of individual. Just let me say, in my instance, I had heart surgery 2009, what's that, 16 years ago and so on. And I have not, there was a time when I felt like you after the operation. Look, I was going to make this thing almost like a vocation in my life to talk to people about it and spread the word. But that hasn't happened. I haven't taken it to heart as you have taken it, obviously, very seriously, to think about it, talk about it, understand something about it. What are the prevalence of the disease in St. Lucia where you are? And perhaps you can speak about the surrounding islands, because I know that there is a closeness amongst the Eastern Caribbean states that we don't understand too well here in Trinidad and Tobago. We're physically different from them.
Yeah, and that's an important question. I mean, one of the things that I've discovered, and Dr. Goetz alluded to it, is that Caribbean men, because we are men of color, Afro-Trinidadian men, but also Indo-Caribbean men, Afro-Caribbean and Indo-Caribbean men. Look at what happened to me, right? For some reason, they're more predisposed to having prostate cancer. And for some reason, they're more predisposed to having a more aggressive form of prostate cancer. A doctor made a comment to me in St. Lucia. He said, people don't test until it's very late in the day. And he actually analyzes a lot of the tests that come to him, the biopsy tests. And he said 70% of the time, 80% of the time, when he looks at it, you have cancer. And he says, that's unfortunate. He can tell you if he gets 10 tests today, 8 out of the 10 probably positive. And that is because by the time they get to that point where they test, it's very late in the day. And the message you really want to drive home, and this is for all the islands. Tobago, I think, is in the top 5 or top 3 islands in the Caribbean, if not this part of the world, where there are higher incidences of prostate cancer. And the message we really want to get out is for men to start taking this thing seriously, to take a step towards saving their own lives. As Dr. Goetz said, the PSA test is the first marker, the first, one of the least intrusive forms of screening, but it's not 100%. Infection can drive a high PSA. Sometimes your PSA, as Dr. Goetz said, doesn't reflect the fact that you may have it. It has to be a holistic approach, which includes the exam, which, God forbid, you get to a point where you have to do a biopsy, but you have to take it seriously.
Okay. I want you to talk about family involvement. You talk about your family. How was the family involved in this whole process of you going through all of this? People must be saying, what's going to happen with this man, etc.
So I kind of took a lot of it onto myself, and there's a reason for that. I told you my dad, and I wrote about all of this as well. We lost my dad to cancer. Ironically, my birthday was a few days ago, and I'm now the same age he was at when he died. And it was an extremely traumatic experience for us. This was in 1999, and by the time between him being diagnosed and him dying, it was 6 months. Our world turned upside down in 6 months. And when I found out how aggressive my cancer was, I started to wonder, I mean, when I do my research, there were periods I thought, well, I have a few months left. And I actually started putting things in place. I started getting my house in order because, I thought, maybe it's months, maybe it's 3 years, maybe at 9, they say you could have 3 to 5 years. And I started measuring my life in terms of months and years because I really didn't know. And that, especially during that 3 or 4 month period I was waiting for my surgery, I had to deal with a lot of that. And I said, having seen what it did to my mom, I said to myself I wasn't going to tell her until I'd beaten it. And I really didn't tell too many people, my immediate family, just my wife, some close friends at work. And they were extremely supportive. And, one of the things I have to do is I really have to commend. One of the most important things is support you get from the people around you. And, the folks at my job at Sandals, they were phenomenal. I mean, they stepped up and they were like, and from the chairman come down, they were extremely supportive in terms of anything that I needed. So, in terms of work, in terms of the strong family circle, but more importantly than anything else, I think, Tony, and a lot of people who would have known who I was growing up, and again, it's something I wrote about in the book, and how involved I was in terms of where we would have come from in terms of just what life is about. Would see a very different journey, and again, it became a very spiritual journey for me as well. And I found a lot of strength and guidance in terms of that spiritual journey that helped take me through.
All right. I want Sir Charles to come in before we end up in a short while from now to once again give our listeners and our viewers an indication of the station where you can listen to us and look at us on different frequencies and so on. And he can tell you about that online. We're an online station, and it's important that you know those things. So, Sir Charles, are you back there?
Yes, I am, Tony. So if I felt like I deserted you,
That's all right. I know you must have been attending to something that's important.
Yes, I just had to move away for a few minutes.
Sure.
But people, you can listen to us. We are streaming on New Era TTRadio.com, and you can also get us on New Era TT Radio on TuneIn. So on TuneIn, you get us on all of your Google and Alexa devices. We are also on Facebook. You can get us on Facebook and YouTube. And in the morning period, our morning drive, it goes on Gael Caribbean. So as I said, a number of ways you can get us. And if you want to advertise with us, you can also give us a call at 281-1315. Yes, call us, and we'll be happy to have you on board to do some advertising with us on the platform.
And of course, Charlo, that last point that you make is critically important.
Very.
We cannot exist on goodwill.
No.
There has to be something more in the kitty than goodwill.
Yes.
Yeah. So that, and of course, the more of the wider base of listeners that we have, the greater the possibilities for widespread advertisement. So we urge you to come in, make your presence felt, and as we go along on this journey. We go back to Sunil Ramdeen, who is a survivor. I don't know if that term is used in the disease, the rehabilitation thereafter, and so on, who has survived the prostate cancer, all of the experiences that you talked about, not only physical, but mental, and all of the other things that went into having the disease. So your wind-up comments, Sunil, and also talk about how and when the book will be available. I think you hinted at the possibility of coming to Trinidad. Sunil, incidentally, is a Trinidadian from the place they call Princess Town, deep in the south of the country. And he has been working abroad with the Sandals Group of Hotel for quite a number of years now. And he's one of those persons who suffers from the chronic disease of being a West Indian cricket fan, painful, perhaps more than the prostate cancer. Your wind-up comment, Sunil.
I know I don't suffer alone, Tony. One of the things I should mention as well is I don't consider myself really a survivor. You have to keep testing your PSA levels, and this is something maybe I should have mentioned. So after surgery, I had to do a PSA test at 6 weeks in, and my PSA levels needed to be at 0. It's never quite at 0. The instrument says 0.09. And that is how a good indication that they got all the malignant cells out. And that was a traumatic time for me, waiting on that 6-week phone call. And then every 3 months after that, I had to do a PSA test, and it had to stay at 0.09. It had to stay at 0, or else, it would have returned. So I did it every 3 months. And then after a couple of years, it went every 4 months. And now I'm 3.5 years in. And my doctor said I could do it every 6 months, but I still do it every 4 months, just based on how aggressive my cancer was. And it never gets easier. Every time you go to get the results of your PSA test, you get a chill in your stomach. It never gets easier. And it'll probably be like that for the rest of my life. There's some timelines, 3 years, you need to get 3 years is a good marker to get past initially. I'm at 3.5. My next marker is 5 years. Once I get back 5 years, that's a good marker to get past. So that's my next marker. So it's a constant process. I don't consider myself a survivor in the sense, I've been able to defeat it with the grace of God. And every day I continue to fight, whether it be with diet, whether it be with exercise, you continue to fight every single day in terms of making sure that your body is so healthy. It's, any cancer cells out there, you keep them. If there are any cancer cells out there that might have escaped that are not yet active, you want to eliminate them, or you don't want them to ever become active. So it's always at the back of your mind. Yeah. But the very strong message I want to send is, again, this is a form of cancer that is slow moving. So if you catch it early, you can treat it. It's not an old man's disease. Younger and younger people are being diagnosed with it. So if you're 40, you want to start exploring your blood test, your PSA test, insist that your doctor do it. Insist, this is your life that you're talking about. Some folks might look at you and say, you don't need that yet. Well, you do it. And if you have a history of prostate cancer in your family, mainly on the male side, your dad's side, you're at a high risk of getting it. So if you're out there listening to this, I urge you at this moment to go and do a PSA test. But don't panic. Don't panic. Many things that can drive a PSA. Have a conversation with your doctor, who may refer you to a urologist. Don't be afraid of the physical test. It's a test. Look, the digital rectum test, the physical test, look at it as a test to save your life. Don't look at it as anything else. Yeah. That's all you're doing. You're taking a step that may save your life. And really, really protect yourself. And with the advances in medicine, try to catch it early. Don't be like me.
Yeah. Sunil, perhaps the major thing that I've got from this conversation is for it to register in my mind, and I hope it has registered in the minds of all those who have listened to us and looked at us, how precious life is. That we reach to a point, on a day-to-day basis, we live our lives and we assume that we will get up in the morning and go through the process again and again. But unfortunately, that's not assured to any one of us. And the life that we have is so precious to us that we have to guard it. Sunil Ramdeen, thank you very much for chatting with us this afternoon. And I'm sure that we'll be in contact at some future point in time, not only in the painful business of cricket, but outside of that. So great to have you on. Great to make contact with you again. And
Tony, I really wanna thank you for the opportunity to do this. I think this is so vitally important. This conversation is about saving lives. I know Sir Charles is probably going to send me a bill, but just to remind everybody, the book is available on Amazon. Right. It's the name of it is Chosen. Just put my name in, and you can get it. And I really hope. I want to come home to Trinidad to launch it maybe sometime in October.
Right. When you do, please inform us so that we can be there with access to radio and television, and we can cover the launch. Thanks a lot, Sunil Ramdeen.
Thank you.
And folks, from tomorrow, Wednesday and Thursday, you will have Andy Johnson here with you, and I'm sure that he's going to have some interesting programs for you. Bye for now. Take care.
Thank you very much, Tony Fraser, and thank you very much to Sunil and our doctor earlier on inside of the Drive Time Exchange. All right, people, keep it right where you are. Coming up in a short, David Mohammed with the Black Agenda.
Sugar Island, sweet precious island. I would never let you go, no. Come for holiday. Take a trip, Maracas, Jamaica, shark spicy.